Hello, I'm Elaine Hunter and I'm delighted to be here with you today to share our work in Scotland to deliver a coordinated and strategic AHP approach to rehabilitation in dementia to improve outcomes. When I speak about allied health professions, I'm including dietitians, occupational therapists, physiotherapists, podiatry and speech and language therapist. I'm going to start by considering an emerging debate on dementia and rehabilitation, both complex areas that need to be carefully and thoughtfully considered, and I was delighted to see rehabilitation as a topic at this year's conference. The text by Marshall in 2005 at that time offered us 4 approaches to rehabilitation, and 16 years later we see the text by Lowe and Laver that includes a range of evidence-based interventions such as occupational therapy, exercise programs, psychological therapies, and working with families to optimise independence. However, despite a significant body of evidence, Swaffer suggests healthcare providers have continued to ignore rehabilitation for people with dementia and calls for a new pathway of diagnostic support. I'm now going to share with you how we're developing a new pathway as allied health professions in Scotland. In 2017, I developed an evidence-based approach to HP practice that integrates research evidence, clinical expertise, and the voice of the person with dementia and their families. The HP approach focuses on 5 key elements, but must be considered collectively within overall universal, targeted, and individual HP-led rehabilitation and support for individuals. But what does this look like in practice? I lead a Scottish national programme working with over 50 allied health professions to deliver a strategic and coordinated approach, integrating improvement science to design tests of change and measure impact. We're transforming our contribution by developing a tiered approach to access AHP's expertise and knowledge that is available when people living with dementia and those who support them need it. At Universal, we've developed a range of accessible AHP-led self-management resources available in a range of formats. For example, we've shared over 3,000 daily hints and tips at our AHP Dementia account. We've developed 6 information sheets with supporting podcasts. We've delivered 16 dementia-friendly exercise videos, and we've designed an interactive website called Connecting People, Connecting Support Online, which to date has had over 73,000 views. Targeted is where we work collaboratively to provide tailored consultations, support and self-management advice. And over the past 12 months, we've delivered 12 HP webinars to over 5,000 people. Individual is when you require direct access to personalised and tailored HP rehabilitation when a need has been identified. We're delivering occupational therapy home-based memory rehabilitation, a post-diagnostic intervention to over 800 people in Scotland. We're testing a post-diagnostic peer self-management group called Journeying Through Dementia in 5 regions of Scotland. And our podiatrists are leading on a project called CPR for Feet in care homes in an area for Scotland. But how have we done this? How have we made this happen? Our enablers for change, I would suggest to you, is at all times we are guided by the voice of people living with dementia and their supporters, so we respond to information and areas of advice and hints and tips that they're asking for. Our tiered approach to universal, targeted and individual offers us a strategic vision for change. We have a national network of local AHP leaders that can respond to local population needs in our work. And by integrating improvement science, we're able to start small, think big and measure the impact. However, we've still much to do to support a new pathway of diagnostic support that integrates access to rehabilitation for people with dementia. So in summary, rehabilitation in dementia is emerging as a right for people with dementia and their families. However, the recognition of the benefits of rehabilitation in dementia is still evolving, with many barriers to timely access. We need to work in partnership to ensure rehabilitation is integral to dementia care and available on diagnosis, with the overall aim to increase a person's quality of life and independence, while also support a person's hopes, aspirations and dreams. Thank you very much for listening to my presentation today.